It is Friday. Everybody knows what happened yesterday, right? The big news that's engulfed and taken over all the oxygen in regards to where we're at as a nation when it comes to our health care really happened yesterday. Everybody was waiting to see what the Supreme Court would rule. Period. When I think of health care and insurance in North Dakota, I think of Blue Cross Blue Shield. I think of Noridian. I think of Paul von Ebers. We had this lined up for quite some time. He was gracious enough to say yes. He is in studio with us right now. Paul, good to have you on News and News.
Thanks, Joel. Glad to be here.
What was your initial reaction when the Supreme Court ruling came down? Hopefully you weren't watching Fox or CNN. I was looking at the screen watching Fox News, and Fox News scrolled, it's been overturned, and now they're in full reverse saying, whoops,
Well, actually, we were in a board meeting yesterday morning, and we all knew the decision was coming down, and so we didn't have a television in the room, but we were looking online, and we were waiting, and about 9:15, everybody's looking at their computers and saying, it's upheld, it's not upheld.
Nobody knew. Still.
There was a crazy rumor that Justice Roberts had resigned yesterday, and it lasted about 5 minutes.
I heard that rumor too.
And that was a silly rumor, but for about 10 minutes, nobody knew what was going on. And it was a very strange thing. I think we were surprised by the ruling, not so much by the outcome, but how they got there. The way the decision was structured was unusual, and we had mapped out all these different scenarios, and we didn't map out this one.
No one did.
Yeah.
No one did. All the pundits, all the predictors, everybody, no one got to the point where in any scenario, Justice Roberts was the one who came and said, look, they don't have the power to do it this way. They don't have the power to do it this way. But the federal government does have the power to tax. And if they treat this as a tax, which you and I both know President Obama avoided. He did.
Right.
He avoided because that word is like, saying leprosy. I mean, it doesn't go that well in America right now, obviously. And so by calling it what they did and packaging it the way they did, Justice Roberts said, wait a second, they do have the power to do this, but let's just call it what it is, that there's a tax involved here.
Yep. So, the bottom line is the Supreme Court has ruled it constitutional, and now we got to go ahead and implement the law. I know there's still going to be a huge political debate between now and November, but for an organization like Blue Cross Blue Shield in North Dakota, we just got to keep trucking along and implementing the law, because it is the law, and we need to go forward.
Well, we're going to get to some of that in a little bit. The exchanges, for example, North Dakota just kind of turning a deaf ear towards this whole what might happen scenario. I heard the head of the Senate Human Services Committee talking about that, and I was really surprised at some of the responses she gave. It's like we're still 2 years back fighting some things that have already been fought. I mean, I can sit there, I hate it when the interstate went down to 55 miles an hour, but the interstate went down to 55 miles an hour when they pulled me over and I was going 65. I sent them a check. I knew what the rules were at that time. So we know what the rules are now. We can have a debate over whether or not that may change in the fall, whether repeal may happen. I get all of that. But we certainly now today do know what the rules are. You tell me, from a perspective of Blue Cross and Blue Shield, what's good and what's bad about these rules?
Sure. This is a very complex law, as we all know. We've implemented part of the law already, and they're really some of the most popular provisions of the law so far. For example, young people up to age 26 being able to get on their parents' policies. Very, very popular part of the law. That's implemented. Preventive care without co-pays or deductibles, that's implemented.
Wellness visits.
Right, and that's very popular, and we see those as positive effects. There are some things coming down the road that we think aren't as positive. Two of them are that there will be a tax on health insurance. And, if we're trying to keep the cost of health insurance down, it doesn't make a lot of sense to put a tax on top of that. And so that will increase premiums. Not a huge amount, but we think anything added on to premiums is a bad idea. It's about $60 a month for an individual and about $200 a month for a family. And, not a month, A year.
A year.
I apologize.
I was going to wait and be polite.
Yeah, sorry about that.
Because actually the cost is, I don't want to say minimal. $200 is $200.
Right. And I always think in terms of per month. And
it does beg the question, though, Paul. If you, when I was managing rural water, and we were going through a time in healthcare in this nation when people representing you would come into my office and say, look, we got a 22% premium increase this year. We've got, one year it was 18 and we high-fived because it wasn't in the 20s. Wasn't that a tax?
Yeah. Oh, we've had very high healthcare costs for a long period of time. We're lucky in North Dakota that our costs are lower than some other states, but they're still very high compared to family incomes in the state.
No, but my point is, I couldn't control it. You were doing, I think, the best that your organization could do for me. I wasn't going to drop health insurance for my employees.
Yeah, I get what you're saying.
I was in a box. I had
Sure.
to pay it whether I liked it or not, and in the end, my employees got health care.
Sure. I mean, this is an important point about healthcare that people don't always realize, is we all want the best healthcare available. But for many individuals and businesses, as the cost of healthcare goes up, it's a trade-off on other things. So businesses can hire fewer workers when healthcare costs go up, and households can't afford other things because of healthcare costs.
Walk me through a timeline of how this, knowing now that it does become implemented, because as you said, it's very complex. For me to sit here as somebody who doesn't work in the industry and tell you that I fully understand it, I don't. And I'm a talk show host who gets paid to at least understand the subject matter we're talking about. And I can tell you that this thing is so deep and so thorough that I can't tell you every provision.
Right.
So walk me through the implementation of the timeline.
For the average person listening to the show, most of the next most important stuff doesn't happen until the fall of 2013. About right after Labor Day in 2013 will be when some big changes start happening. For example, this insurance exchange, which a lot of people don't know what that is. It's an electronic marketplace. You go on your computer, you go online, and you'll be able to shop and compare health insurance policies. That's what the exchange is. That should be up and running by October 2013 so that people can start making choices for January 2014. So a lot of the new elements of the law start January 2014, but people will have choices to start making in the fall of 2013.
Is that a good thing or a bad thing?
Oh, basically the health insurance exchange I think is a good thing. It will help people shop for health insurance, and there are federal subsidies that will be available for health insurance. The trade-off there, is that it will make it easier for people to buy insurance. It'll make insurance cheaper to them, but it won't lower the cost of health care for the country. It's going to be part of the federal tax bill then.
Because it's all about amortization, and if I'm young and I can buy it cheap in Vermont, that's one thing, but if I'm somebody with a busted up knee at 50 years old, I'm still part of the health care situation.
Right, and this law helps us pay for health care, but it doesn't make the cost of health care go down. So basically, we're all going to pay for it anyway. We're going to pay for it through taxes, through lower wages, or directly out of our pocket.
Let me ask you this. The exchanges themselves, and this is, I think, important, and this goes back to what I was getting at about Judy Lee. The state of North Dakota chose not to move forward on this. I mean, the state of North Dakota, and my argument during the legislative session, I brought this up, so I'm not doing the hindsight thing here, but the state of North Dakota chose not to move forward on this because they, in my opinion, this is mine, and actually Al Carlson confirmed that one day on air, they saw that as an endorsement of what they call Obamacare. And so they weren't going to move forward because they put all their eggs in the basket of this is going to get overturned by the Supreme Court. I made the argument to Al one day on air. I said, why wouldn't you move forward with the exchange? And then, if it gets overturned, all you're out is the work. I mean, rather than take to the airways like Judy did yesterday where she's talking about, this is evil, this is bad, this is, and that's, Judy always tried to find solutions. I'm not trying to bash Judy Lee, but it seems to me that the work wasn't done last session. Now you get a broader perspective from a nation. Are you playing a role in setting up exchanges? Are your colleagues? How is this exchange thing working?
Yeah, actually, our organization, we have a company that does work for government programs around the country. It's called Meridian Administrative Services. And we're actually building the exchange in Maryland right now. So we do think it's a good idea for each state to have their own exchange, because it allows local people to make the decisions about healthcare in their state.
Right.
And we would like to see North Dakotans make the decisions about healthcare in North Dakota. So we'd really like an exchange here. And I know the political environment has been very intense. I'm not going to look...
It's going to get just as intense.
Yeah.
It always was going to be there.
And I'm not going to look back and, criticize one side or the other. I just think we need to move forward to create a state exchange. There's not likely to be a special session. We're probably going to have to wait till January when the new session starts, and that's late. I'm hopeful that maybe
because by Labor Day,
right,
most states have to have this in place.
Yeah, it's got to be operational by October.
So if the law, because the process of this law for the exchange, it becomes law. I mean, how do you get all of this done in just a couple of months?
It's going to be extremely tight. I'm not even sure it's physically possible. We may have to hope that the federal government gives us a little more time.
So if you don't meet the timeline and the criteria, what happens?
Well, then the federal government sets up the exchange.
So now you've allowed the federal government to have that control when you yourself had it within your power to do it.
Right, and so the federal government will have more influence over the type of insurance products that are offered in the state, and also which insurance companies can offer a product on the exchange. And we would rather have North Dakotans make those decisions.
I think that's fair.